Knowing exactly what it feels like to have monkeypox, Matt Ford has taken to social media to now warn people about the virus.
This sucks and you don't want it.
I've got these on my arms.
But now his frustration is that even as awareness grows, those who need it might have a hard time finding a vaccine.
The supply is so low that there's not that much to go around.
Since May, the number of cases in the United States has continued to grow quickly. But the 2-dose Jynneos monkeypox vaccine has been rolling out slowly.
We got an allotment of 200 vaccines, and the appointments for that went in about an hour and a half.
New York City Mayor Eric Adams has reached out to the White House to underscore his state's unmet demand. The 2 doses are usually given 4 weeks apart, but Mayor Adams wants the White House to consider a longer interval in between the doses, so more first doses could be administered immediately. Right now, the CDC recommends the vaccine for high-risk individuals, people who have been diagnosed with or exposed to monkeypox, and people who are at higher risk of being exposed to monkeypox. That means not for the general population's prevention.
The problem is we simply don't have enough vaccine. So we're trying to play catch-up. We need to get vaccination to people because we know that vaccinating people may not necessarily prevent the infection, but it will certainly decrease the severity of disease.
The CDC estimates this vaccine is at least 85% effective. Giving it within 4 days of exposure is best to prevent the onset of disease, and even if given within 14 days of exposure, it may still reduce the symptoms.
I'm looking at something that I've never seen before as a doctor. I want to introduce you to Koi. She's 22 years old, and what she has is an active case of monkeypox.
But this is not necessarily what monkeypox always looks like. For Matt Ford, the lesions started smaller and not as obvious.
I maybe would have suspected that they were like the herpes simplex virus or some other skin condition.
Right now, public health officials are sounding the loudest alarms in the LGBTQ community. That's due to most cases being reported in men who have sex with men. But experts warn the outbreak could still expand.
It's very reminiscent of the early days of HIV, right? In which it was impacting, men have sex with men, the gay community in the United States, and it's almost like the general public were not paying attention. And then HIV became a disease that affected other people. It affected everybody, and then all of a sudden people got interested.
And to give you a little context here, there are about 132,000 doses of this vaccine that have now been distributed to states. But if you look at who's considered high risk, who would be eligible here, it's about 1.5 million people. So there's the shortfall. There will be more doses forthcoming in the fall, but obviously there's a huge demand right now.